Musculoskeletal disorders are the leading work-related health concern in the European Union, causing disability, absence from work, and loss of productivity. Reports suggest that the average cost of musculoskeletal disorder to exceed €21,000 and in total up to €240 billion for the European region. The European workforce is aging, and with aging comes greater risk of poor health. Older workers may be more susceptible to work-related musculoskeletal disorders than younger workers due to a decreased functional capacity. 7% of the European Union's working population are employed in health occupations. 36% of these workers are 50 years or older. Compared with other industries, healthcare workers are known to be subject to some of the highest risks of musculoskeletal disorders. In the United States, musculoskeletal disorder in hospital workers are double all other industry averages. In 2015, 47% of healthcare workers experienced back pain. Tasks such as manual patient handling and pushing and pulling of equipment can place high loads on the musculoskeletal system, particularly the shoulders and lower back. At Stryker, the health of patients and healthcare professionals is at the heart of what we do. With the help of 4Life Kinetics state-of-the-art sensor technology, we captured the biomechanical impact of manual patient handling on a healthcare professional's physical well-being. Real-time body movements were analysed and compared against international standards. Based on the data received, risk assessments can be produced and adjustments can be made to provide an ergonomic workplace, reducing the biomechanical overload risk and therefore enhancing caregiver conditions, the outcome of which may reduce work-related injury, costs and absenteeism. Healthcare professionals are regularly required to transfer patients between departments. When preparing a patient for transfer, always consider the patient's condition, tailoring their case based on the situation. For example, if a patient has a lowered level of consciousness, protect their safety by raising the side rails prior to elevating the height of the bed. High-frequency, repetitive handling, such as a manual foot pump, can lead to a musculoskeletal strain, as well as increase the risk of fatigue, discomfort, and disorders. Exertion of force is largely determined by the posture a person adopts. Awkward postures may reduce the ability to exert force and increase risk of injury from high loads being placed on body joints. Despite the caregiver's good posture, the healthcare professional takes on the patient's weight when lifting the head of the bed, causing the lumbar disc compression indicator to exceed safe working limits. When pushing and pulling, both the frequency and duration of the applied force should be considered. Initial forces are used to overcome the object's inertia, while starting or changing the direction of movement. To initiate movement of the standard stretcher, the caregiver must use significant effort, particularly in the shoulders. The stopping force, which is the force applied to bring an object to rest, is shown by increased exertion on the shoulders and lumbar disc compression. Having the right equipment and technology is an important factor for safe patient handling. Simple adjustments can considerably influence a safer environment for caregivers. Using an automatic foot pedal can help reduce the repetitive pumping motion, shown by an immediate improvement on the caregiver's disc compression. Stryker's BackSmart Lift Assist drop seat design uses the patient's weight to raise or lower the backrest, minimizing the caregiver's effort. The biomechanical load on the caregiver's body, lumbar and shoulders shift from medium to predominantly low impact. Initial forces are generally higher than the sustained forces, therefore should be kept to a minimum. Stryker's Prime Big Wheel is designed to help reduce the initial start-up force and steering effort by shortening the wheelbase when activated, resulting in a significant reduction on the lumbar spine. Lateral transfer is recognized to place caregivers at risk of lumbar overload. The International Organization for Standardization emphasized that when a patient is unable to fully cooperate with the lateral transfer, it places high and unacceptable risk on the caregiver. However, by incorporating small aids such as a pat slide or sliding sheets, the risk may be lowered from high to medium level. Shown is common practice for lateral transfer. Despite many good techniques throughout the example, the data highlights there remains room for improvement. Inserting a pat slide under the patient prior to positioning the stretcher next to the bed can help decrease overextension of the shoulders from having to stretch across the mattress. Incorporating aids such as slide sheets may help reduce pushing-pulling forces for the caregiver. Use of slide sheets will also help reduce shear force for the patient, lowering the risk of pressure injury. Attaching extension straps to the side sheets can help minimize unnecessary extension of the spine. Repositioning a patient is a frequently conducted maneuver, often performed manually by the caregiver. Here, the caregiver's posture is twisted, which can decrease force exertion ability and may increase the risk of injury. In addition, attached to the caregiver twisted posture is the patient's weight, causing almost 700 kilograms of load to compress on the lumbar spine. Simply modifying practice to position the caregiver at the head of the bed and utilizing the patient's bedsheet reduce the load by 66% to 235 kilograms, which is within a safe range. To improve practice, try increasing the number of staff, incorporating slide sheets, and adjusting the caregiver's technique to redistribute their weight with the step-back motion when pulling. During a busy shift, with limited human resources, it's not always possible to work with additional staff. When a caregiver is required to independently assist a patient from a lying to seated position, it can induce notable stress on the caregiver's neck, shoulders, and back, demonstrated by the biomechanical sensor data exceeding safe working limits. Using a stretcher with a powered backrest can help reduce load on the caregiver caused by manual lifting. Adjusting the height of the bed to suitable working position and, where appropriate, seeking support from a colleague will further contribute to ergonomic care. It is common for a caregiver to manually assist a patient to stand. Here are two techniques often practiced in the hospital environment. In the first instance, the caregiver is positioned in front of the patient, supporting the bulk of the patient weight. This causes approximately 900 kilograms of load to compress the lumbar spine. An alternative method is when the caregiver is positioned next to the patient, supporting the back and placing a hand over the patient's shoulder. Now, the exerted load averages less than 235 kilograms and within safe working limits. Work-related musculoskeletal disorders in healthcare workers remains prevalent within Europe, and this is likely to increase with an aging population and prolonged working life. Reducing work-related musculoskeletal disorders is of international concern. Several manual handling practices were shown and evaluated using biosensors, emphasizing that attention is needed to protect the safety and well-being of caregivers. With modest adjustments to patient handling techniques and the integration of ergonomic tools and equipment, it is possible to help provide a safer environment for caregivers and their patients, ultimately leading to a reduction in avoidable injuries, costs, and absenteeism. At Stryker, together with our customers, we are driven to make healthcare better.